Puberty is a natural and important stage in a girl's life. You all must be knowing the changes during puberty. But here are some lesser known and interesting facts about puberty in girls. Physical changes during puberty. One of the earliest physical signs of puberty in girls is breast development. It is very common for one breast to grow faster than the other. This difference is completely normal and usually evens out over time, although perfect symmetry is not always achieved. Before these visible changes appear, many important changes are already happening inside the body. The ovaries and uterus begin to mature silently, sometimes months or even years before any external signs are noticed. As estrogen levels increase, many girls notice a clear or whitish vaginal discharge. This is called physiological leukorrhea. It usually appears several months before the first menstrual period and is a normal sign of hormonal activity, not an infection. Another major change during puberty is a sudden increase in height, known as the growth spurt. Interestingly, the fastest growth usually happens before the first period. After menstruation begins, only a small amount of height growth remains. During this phase, body fat distribution also changes. Fat tends to increase around the hips, thighs, and breasts. This is a healthy, hormone-driven process that prepares the body for reproductive maturity and should not be mistaken for unhealthy weight gain. Puberty also activates sweat glands known as apocrine glands. These glands produce sweat that, when broken down by bacteria, causes body odor. This is why good hygiene becomes more important during adolescence. The voice may change slightly as the larynx grows, though this change is usually subtle in girls. Skin changes are also common. Increased hormone levels stimulate oil glands, leading to acne. Acne is not caused by poor cleanliness. It is mainly a hormonal effect. Emotional and psychological changes. Puberty affects not only the body but also the brain. During adolescence, the emotional part of the brain develops faster than the rational decision-making part. This imbalance explains why mood swings, emotional sensitivity, and impulsive reactions are common. Hormonal fluctuations can make emotions feel stronger than before. Girls may feel happy, sad, angry, or anxious more intensely, sometimes without a clear reason. These emotions are real and valid, not exaggerated or imaginary. Many girls also experience a growing need for privacy. This reflects increased self-awareness and personal identity development, which are healthy signs of emotional maturity. Sleep patterns often change during puberty. Hormonal shifts delay the release of melatonin, causing adolescents to feel sleepy later at night and tired in the morning. This biological change can make early school schedules challenging. Peer approval becomes very important during this stage. Adolescents may become more sensitive to opinions, comparisons, and social acceptance. Sometimes lower self-confidence, especially when physical development differs from peers. Important reassurance and when to seek help. It is important to remember that puberty has no fixed timeline. Some girls develop earlier, others later, and both are normal. However, medical advice should be sought if puberty starts before the age of 8, if no signs appear by 13, or if menstruation does not begin by 15. Severe acne, excessive hair growth, or extreme emotional distress should also be evaluated. Conclusion: puberty is a period of growth, adjustment, and transformation. It prepares the body and mind for adulthood and is a sign of healthy development. With correct information, supportive guidance, and open communication, this phase can be navigated with confidence rather than fear.